On behalf of the Government of Canada, I am honoured to address the World Health Assembly. I join all colleagues in thanking Dr. Chan for her leadership as Director General. Canada has a long and proud history of supporting healthcare systems that promote health for all, including the most vulnerable. It is often said that the true measure of any society is found in how it treats its most vulnerable members. That is why we are steadfast in our commitment to global health equity, together with our international partners. We support this Assembly's vision to pursue sustainable development through strengthening health systems. It was almost 40 years ago when the Declaration of Alma-Ata was adopted at the International Conference on Primary Health Care. The nations that supported the Declaration, including Canada, committed to protecting and promoting health for all. They highlighted the importance of primary care as a means to accomplish this goal. The principles of Alma-Ata remain as relevant today. Strong health systems rooted in primary care will be effective, efficient, equitable, and accessible. We can achieve the targets of the Sustainable Development Goals, but we need to increase efforts to build integrated health systems by applying the principles of Alma-Ata. This means more than achieving strong systems for treatment. It also means addressing the upstream determinants of health. That is why the Government of Canada is working to improve access to housing, employment, education, and economic opportunity, because these factors also influence health outcomes. I have seen this with my own eyes. As a physician, I learned that there was only so much I could do within the walls of the clinic to help my patients. I experienced firsthand how climate, food, water, shelter, and education were as important as healthcare for ensuring a healthy population. Now I tell my colleagues in the Cabinet who oversee other departments that every minister in government is, in some way, also a health minister. Like all nations, Canada faces its own challenges. We are directly confronting the uncomfortable reality that not all Canadians enjoy the same health outcomes. In particular, we acknowledge that Indigenous Canadians experience health outcomes that lag behind the general population on several measures. Our government is making significant investments to address these inequities. We are also addressing the growing number of people in our country who have inadequate access to mental health care. And we are grappling with an epidemic of overdose deaths related to the use of opioids, a serious public health challenge. We are making historic investments to transform health systems in Canada to address these needs and meet the needs of our population. The foundation is solid. Our conviction that access to health care should be fair. This includes universal health coverage, where citizens will always receive care based on need, not based on their ability to pay. As Canada addresses healthcare challenges inside our borders, we also support international bodies like this Assembly, whose mandate is to improve health around the world. Recall the words of Martin Luther King Jr., who said, "We are caught in an inescapable network of mutuality, tied in a single garment of destiny. Whatever affects one directly affects all indirectly." Canada is honoured to participate in this Assembly and to partner with you to address the social determinants of health, to promote the importance of primary care, to uphold universal health coverage, and to affirm equity as a fundamental principle of global health. Thank you. Merci beaucoup.